The fluorescent lights in St. Jude's fourth wing hummed with a frequency that made Sarah's teeth ache. She'd been a nurse for 3 years, but this was her first assignment to Unit 400, the decommissioned wing that administration only mentioned in whispers during shift briefings. The ancient linoleum floors, cracked and yellowed with age, stretched down corridors that seemed to extend far longer than the building's blueprints could possibly allow. It was 2:47 a.m. when she arrived at the primary nurses' station, a glass-fronted alcove that overlooked the main corridor. The day supervisor had been briefed during handoff. Keep the lights on, do your rounds, don't bother the patients. Then she'd left, her footsteps echoing down the hallway with unseemly haste. Sarah set her coffee on the chipped laminate desk and opened the 3-ring binder labeled Unit 400 Protocol. Inside, tucked between pages of outdated emergency procedures from 1987, she found a single sheet of paper. A page torn from an old patient chart, the edges soft with age and handling. At the top, written in 3 different hands, were the words, Compliance Protocol, Night Shift Survival Guide. Her stomach tightened as she read. The 7 rules. Rule 1. The monitoring light, the red indicator light above room 412 must remain on at all times. Room 412 must remain empty. If the light goes off, the patient from room 312 directly below will relocate to the hallway. You will be required to escort them back. Do not look at their face during escort. Do not ask their name. Rule 2. The intercom call. At 3:45 a.m., the intercom will page Dr. Evans to OR-C. Dr. Evans does not exist. OR-C was demolished in 1983. When you hear this page, you must immediately announce, Dr. Evans is currently unavailable. All surgical staff, please stand by. Use exactly these words. Nothing more. Nothing less. Rule 3. The documentation error. The chart for bed 6 will contain handwritten notes in inverted script, backward writing. You must transcribe these notes onto a fresh chart sheet exactly as they appear. Do not attempt to read them. Do not attempt to correct them. Do not hold them up to a mirror. Complete the transcription by 4:30 a.m. Rule 4. The elevator stop. The staff elevator operates between floors 1 and 4 only. If the elevator stops on floor 5, do not exit. Face the back wall. Place both hands flat against the elevator walls. Count backward from 20. Do not turn around until the doors have closed and the elevator has resumed movement. Rule 5. The 4 drip. The patient in room 409 is connected to an 4 bag containing a non-medical substance. Your shift logs indicate saline, but you will observe otherwise. Log the flow rate accurately, 15 drops per minute. Do not disconnect the line. Do not question the contents. Do not speak to the patient in room 409. Rule 6. The auditor at 05000 am. A security guard will enter the nurse's station and request the midnight census. Hand them the water-stained blank paper clipped to the back of this protocol sheet. If you hand them the actual census, an audit will commence. The audit does not end. Rule 7. The final assignment. At 5:59 a.m., check your reflection in the nurse's station window. You will see a patient seated in the chair behind you. Verify the name on their wristband. If it matches your own, your shift is complete. Update these rules with any new observations. Leave them for the next nurse. Sarah read the rules 3 times, her hands trembling slightly. This had to be some kind of hazing ritual for new nurses assigned to the 4th wing. Medical facilities didn't operate on superstitious protocols. They operated on evidence-based practice, on science, on... The lights flickered. She looked up sharply. The corridor stretched before her, empty and silent, except for the mechanical hum of ancient ventilation systems. 13 doors lined each side of the hallway, their darkened windows revealing nothing. At the far end, barely visible in the dim emergency lighting, She could see the crimson glow of the indicator light above room 412. It was on. For now. Sarah checked her watch, 2:53 a.m. She had just over 7 hours until the day shift arrived. 7 hours to follow a set of rules that defied every principle of modern nursing. 7 hours in a wing that shouldn't still be operational, watching over patients who... She pulled out the census sheet from the binder. 3 names were listed. In room 312, patient J, no last name given. In room 409, patient M, no last name given. In room 418, patient K, no last name given. 3 patients, no diagnoses, no admission dates, no attending physicians. She was reaching for her phone to call the supervisor when she noticed something that made her breath catch. At the bottom of the census sheet, in faded pencil, someone had written, "They were all nurses once." 3 a.m. The first rule. Sarah forced herself to stand. The rules were clear about Rule 1. The red light above room 412 had to stay on. She needed to check it. The hallway seemed longer when you walked it alone. Her shoes squeaked against the linoleum with each step, the sound too loud in the suffocating silence. She passed room 401, 403, 405, all empty, their doors standing open to reveal stripped beds and empty IV poles that cast spider-leg shadows in the dim light. Room 409 was closed. She could see a sliver of light beneath the door, and as she passed, she heard the steady drip, drip, drip of an IV line. 15 drops per minute, she remembered. Rule 5. She wasn't supposed to check that until later, but already her nurse's instincts were screaming at her to verify the patient's condition, to ensure the line wasn't infiltrated, She kept walking. Room 412 was at the end of the corridor, positioned oddly far from the other occupied rooms. The red indicator light above the door glowed steadily, a small beacon in the darkness. Sarah stood before it, studying the light fixture. It looked original to the building, a simple bulb behind red glass, the kind of system that hadn't been used in hospitals since the 1970s. The room's door window was covered from inside with what looked like black paper. She tried the handle, locked. Behind her, somewhere deep in the wing, metal scraped against metal, the sound of a bed frame being moved, or perhaps a gurney being wheeled across uneven flooring. Sarah spun around, but the corridor was empty. She hurried back to the nurse's station, her heart pounding. The red light was still on. That was good. That was fine. She just had to make sure it stayed that way for the next few hours. How hard could that be? 3:30 a.m. Observations. Sarah tried to distract herself with paperwork. There were medication logs to review, though no medications were listed. There were vital signs to document, though no parameters were given. Everything about Unit 400 existed in a state of bureaucratic limbo, official enough to appear legitimate, empty enough to avoid scrutiny. She thought about the other nurses who'd worked this shift. The rules had been written in 3 different hands, suggesting at least 3 previous night shift nurses had survived the protocol and added their own observations. Or maybe survived was too strong a word. Maybe they'd simply complied. The distinction seemed important. At 3:33 a.m., Sarah heard footsteps in the corridor, slow, shuffling steps that seemed to come from nowhere in particular. She stood and peered through the glass wall of the nurse's station, but saw nothing. The footsteps continued for perhaps 30 seconds, then stopped. The red light above room 412 remained on. She checked it obsessively now, her eyes flicking to that distant crimson glow every few seconds. The rules said, if it went off, the patient from room 312 would relocate to the hallway. What did that mean? Would they wander? Would they need assistance? And why couldn't she look at their face? They were all nurses once. The penciled note haunted her. Had the patients in Unit 400 once stood where she stood now, following these same rules. And if they'd followed the rules correctly, why were they still here? At 3:42 a.m., she decided she needed to see the patient in room 312 for herself. 3:45 a.m. The second rule. Sarah was halfway down the corridor when the intercom crackled to life, paging Dr. Evans to OR-C. Dr. Evans to OR-C, stat. The voice was female, professional, utterly routine, except for the slight quality that suggested the recording was decades old, played through speakers that had degraded with time. Sarah froze mid-step, her mind racing. The second rule. She needed to respond. She ran back to the nurse's station and grabbed the intercom handset, her fingers fumbling with the ancient equipment. The button was sticky, reluctant. She pressed it and heard the system activate with a hollow click that echoed through every speaker in the wing. Dr. Evans is currently unavailable. All surgical staff, please stand by. Her voice sounded thin and reedy over the speakers. She released the button and waited, her heart hammering against her ribs. Silence. The corridor remained empty. The red light above room 412 continued to glow. Nothing changed, but Sarah felt a subtle shift in the atmosphere, as though the wing itself had been holding its breath and could now exhale. She'd passed the second test, but in her haste to respond to the intercom, she'd forgotten about room 312. She turned back toward the corridor and her stomach dropped. The red light above room 412 was off. No, no, no. Sarah grabbed her penlight and ran down the hallway, her breath coming in short gasps. When she reached room 412, she pressed her face to the glass, trying to see past the black paper covering. Nothing. The room was dark, silent, apparently empty. But if room 412's light was off, then according to Rule 1, she turned slowly and looked down the corridor toward the nurse's station. A figure stood in the hallway near room 312, wearing a faded hospital gown that hung loosely on their thin frame. Their back was to Sarah, their head bent forward as though studying the floor. They were perfectly, impossibly still. Sarah's training told her to approach, to ask if the patient needed assistance, to guide them back to their room. But the rules told her something different. Do not look at their face during escort. Do not ask their name. She took a shaky breath and walked forward, keeping her eyes fixed on the floor just ahead of her feet. As she drew closer, she could hear the patient breathing, slow, raspy breaths that seemed to catch on something wet in their lungs. The smell hit her next, antiseptic mixed with something organic and decaying, like flowers left too long in stagnant water. I need you to return to your room, Sarah said quietly, her voice steady despite her terror. I'm going to walk behind you. Please proceed to room 312. The figure didn't respond, but after a moment, it began to shuffle forward. Sarah followed, keeping her gaze lowered. She could see the patient's feet, bare, pale, the toenails thick and yellowed. With each step, they left behind a faint wet impression that evaporated within seconds. They walked in silence down the long corridor. Sarah counted the doors as they passed. 407, 405, 403. The patient's breathing grew louder, more labored. Sarah's instinct was to check their oxygen saturation, to assess for respiratory distress, but she kept her hands at her sides and her eyes on the floor. When they reached room 312, the door stood open. The patient shuffled inside, and Sarah quickly pulled the door closed, her heart pounding. She didn't look up. She didn't see their face. Only when the latch clicked did she allow herself to exhale. Behind her, back at the end of the corridor, the red light above room 412 flickered once, then returned to its steady glow. 4:15 a.m. The third rule. Back at the nurse's station, Sarah collapsed into the worn office chair and pressed her palms against her eyes. Her hands were shaking. She'd been a nurse long enough to handle difficult patients, to manage emergencies, to stay calm during codes. But this was different. This wasn't medicine, this was something else entirely. She forced herself to focus. The third rule: she needed to handle the documentation error. Sarah pulled out the patient charts from the filing cabinet. Most were nearly empty. Vital signs never recorded, medications never administered, conditions never documented. But the chart for bed 6 was different. 3 pages were filled with handwritten notes in dense, cramped script. Sarah held the first page up to the light, and her breath caught. The writing was backward, every letter reversed, every word running from right to left. It looked like someone had written normally, then flipped the text through a mirror. Her first instinct was to hold it up to a reflective surface, to decode what it said. But the rules were explicit. Do not attempt to read them. Do not attempt to correct them. Sarah pulled out a fresh chart sheet and uncapped her pen. For the next 15 minutes, she painstakingly copied each reversed letter, each backward word, exactly as it appeared. Her hand cramped. Her eyes burned. The reversed text seemed to writhe on the page, the letters shifting at the edge of her vision whenever she wasn't looking directly at them. She didn't try to understand what she was writing. She didn't try to make sense of the fragments she could recognize. Words like corridor and transfer and permanent jumbled among the reverse text. She just copied, mechanically, until all 3 pages had been transcribed. When she finished, she clipped the new pages into bed 6 feet's chart and filed it away. Her hands were trembling again, and she noticed with distant horror that she'd been holding her breath for the last several minutes. The wall clock read 4:29 a.m., 1 minute to spare. 4:45 a.m., the 4th rule. Sarah needed to move, to do something other than sit in the claustrophobic nurse's station, watching the minutes crawl past. She decided to restock supplies from the storage room on the 1st floor, a task that would require using the staff elevator. The elevator was located at the center of the wing, a metal door with an analog floor indicator above it. The needle pointed to 4. Sarah pressed the call button and waited, listening to the mechanical grinding of cables and pulleys somewhere in the walls. The doors opened with a pneumatic hiss. The elevator was empty, its interior lit by a single flickering fluorescent tube. The walls were covered in outdated safety notices and a faded inspection certificate from 1988. Sarah stepped inside and pressed the button for floor 1. The doors closed. The elevator lurched downward. Sarah watched the floor indicator above the door panel. The needle moved smoothly from 4 to 3, then hesitated at 2. She could feel the elevator slowing. For a moment she thought it would stop, but then it continued to 1, and the doors opened onto the familiar lobby level. She grabbed supplies quickly, alcohol wipes, gauze, tape, anything to justify the trip, and returned to the elevator. She pressed 4. The doors closed. Going up felt different. The elevator climbed past 1, past 2, past 3. But instead of stopping at 4, Sarah felt the mechanism continue upward. The needle on the floor indicator swung past 4 and trembled at 5, 5th floor. The abandoned surgical level. The elevator stopped with a mechanical groan. Sarah's mind raced through the 4th rule. Face the back wall. Place both hands flat against the elevator walls. Count backward from 20. Do not turn around. She spun around and pressed her palms against the rear wall of the elevator, the cold metal shocking against her skin. She could hear the doors beginning to open behind her, the pneumatic system sighing as it released. 20, 19, 18. She counted aloud, her voice shaking. A smell wafted into the elevator, chemical and sharp, like industrial cleaning solution mixed with copper. No, not copper. Blood. Old blood, oxidized and stale. 17, 16, 15. She heard something in the corridor beyond. Wheels on linoleum, a gurney being moved, and voices, distant, muffled, as though coming from behind surgical masks. They were speaking, but Sarah couldn't make out the words. 14, 13, 12. The voices stopped. The corridor went silent. Sarah realized with mounting terror that whatever was out there was now listening, aware that someone had arrived on a floor that shouldn't exist. 11, 10, 9. Footsteps, coming toward the elevator. Slow, measured, the footfalls of someone wearing surgical clogs. They stopped just outside the doors. 8, 7, 6. Sarah could feel a presence behind her now, standing just at the threshold of the elevator.
She could hear breathing, slow and steady, the breathing of someone watching, waiting. Her fingers ached from pressing them so hard against the wall. 5, 4, 3. The presence leaned closer. Sarah felt the air change, felt the temperature drop. Whatever stood behind her was close enough that she could have reached back and touched it. Every instinct screamed at her to turn around, to see what was there, to run. 2, 1, 0. The elevator doors closed with a decisive thump. The presence vanished as though it had never existed. The elevator lurched downward, and Sarah slumped against the wall, gasping. When the doors opened on floor 4, she stumbled out and didn't look back. 5 a.m. The 5th and 6th rules. Sarah was still shaking when she returned to the nurse's station. She dropped the supplies on the desk and tried to steady her breathing. 2 more rules, 2 more tests. Then she could leave this place and never come back. She checked the time. 4:58 a.m. The auditor would arrive in 2 minutes. But first, she needed to handle Rule 5, the IV drip in room 409. Sarah grabbed her pen light and walked down the corridor, her footsteps echoing in the silence. The door to room 409 was closed, a sliver of yellow light visible beneath it. She knocked softly, then opened the door. The room was small and sparse. A single bed occupied the center, and on it lay a patient connected to an 4 line. The patient appeared to be sleeping, their chest rising and falling in steady rhythm. But Sarah's attention was immediately drawn to the 4 bag hanging from the pole. The liquid inside was wrong. It wasn't saline. It wasn't any medication Sarah had ever seen. The substance in the bag was thick and dark, moving sluggishly when the bag swayed. In the dim light, it looked almost black, but when Sarah's pen light caught it at the right angle, she could see it had a deep maroon color. Blood? No, too viscous for blood. Too dark. She approached the IV pole and checked the drip chamber, counting under her breath. 15 drops per minute, exactly as the rules specified. The line was clean, properly secured, showing no signs of infiltration. The patient's arm bore no bruising around the IV site. Sarah's training screamed at her to assess the situation, to question this obvious deviation from medical protocol. But the rules were clear: log the flow rate accurately. Do not disconnect the line. Do not question the contents. Do not speak to the patient. She pulled out her log sheet and wrote, Room 409, 4 flow rate, 15 GTT min. No signs of infiltration. Patient resting comfortably. As she turned to leave, she made the mistake of glancing at the patient's face. For just a moment, less than a second, their eyes were open, staring directly at her. And Sarah recognized something in those eyes. Something that made her blood run cold. Recognition. As though the patient knew exactly who she was. Then the eyes closed, and the patient returned to their steady breathing. Sarah backed out of the room and closed the door with shaking hands. She made it back to the nurse's station just as the clock struck 5 a.m. The glass door opened, and a security guard stepped inside. He wore a uniform that was decades out of date, a brown polyester shirt with a brass name tag that read Martin. His face was nondescript, forgettable. The kind of face you'd pass in a crowd and never remember. Evening, nurse, he said, his voice flat and professional. I need the midnight census. Sarah's hand moved automatically to the back of the protocol sheet, where a water-stained piece of blank paper was clipped. She unclipped it and handed it to the guard without a word. He took the paper, glanced at it briefly, then nodded. Everything appears to be in order, he said. Enjoy the rest of your shift. He turned and walked out, his footsteps fading down the corridor. Sarah watched him go, then checked the actual census sheet still lying on her desk. 3 patients listed, 3 rooms occupied. But when she looked at the blank paper she'd given the auditor, she could have sworn that for just a moment she'd seen names written on it in faded ink, names that shifted and changed every time she tried to focus on them.
5:59 a.m. The final assignment. Sarah sat at the nurse's station and waited. 1 minute until the end of her shift. 1 minute until she could walk out of Unit 400 and pretend this night had never happened. Except she couldn't pretend, because she knew what the 7th rule would show her. At 5:59 a.m., she stood and faced the large window that overlooked the corridor. In the reflection, she could see the nurse's station behind her, the desk, the filing cabinets, the worn office chair. And sitting in that chair was a patient. Sarah's breath caught. The patient wore a hospital gown identical to the ones in rooms 312 and 409. Their head was bowed, their hands folded in their lap, and on their right wrist, clearly visible in the reflection, was a hospital identification bracelet. Sarah leaned closer to the window, her heart pounding. The name on the bracelet was written in careful block letters, Patient, Sarah Mitchell. She spun around. The chair was empty.
But when she turned back to the window, the reflection showed the patient still sitting there, still and silent. Sarah understood then. She understood why the rules had to be followed exactly. She understood why previous nurses had written their observations in different hands. She understood why the patients had no last names, no diagnoses, no admission dates. This wasn't a hospital wing. It was a way station. A place where people who failed the protocol became permanent residents, undocumented, unassigned, existing in the administrative gaps of the system. And those who succeeded were bound to return, to perpetuate the cycle, to write the rules for whoever came next. They were all nurses once. Sarah sat down at the desk and pulled out the protocol sheet. At the bottom, below the 7th rule, she picked up a pen and began to write in her own hand. Addendum to Rule 7. If you see your own name on the wristband, you have successfully completed the protocol. You are required to update these rules with any new observations before the day shift arrives. You will be released from Unit 400, but you will be assigned to return every 4th week. This is non-negotiable. You are now part of the administrative rotation. Additional observation: the patient in room 409's IV bag contains a substance I cannot identify. Do not waste time trying to understand it. Your job is compliance, not comprehension. Remember, the wing operates on rules, not logic. Follow the protocol. Question nothing. Document everything. Good luck. SM, November 2025. She signed the bottom of the page, replaced the protocol sheet in the binder, and stood. Through the window, she could see the first hints of dawn lightening the sky. The day shift would arrive soon. Sarah clocked out at 6:03 a.m., 3 minutes late. As she walked down the corridor toward the main hospital, she passed the assignment board for the night shift. Her name was listed under Unit 400, 4th week rotation. Below it, a new name had been added for next week's shift. She kept walking. Behind her, the lights in Unit 400 dimmed, but did not go dark. The red indicator above room 412 glowed steadily, and in the nurse's station, the binder sat waiting on the desk, ready for the next nurse who would find the rules and wonder, for one brief moment, whether any of it was real. By the time they reached Rule 7, they would know the answer.
3 weeks later, Sarah returned to Unit 400 for her second shift. The rules were exactly as she'd left them, with one addition at the very bottom. Note for SM: the patient in room 418 will ask for you by name. Do not respond. Do not acknowledge. Pretend you cannot hear them. AC, November 2025. Sarah read the addition twice, then filed it away in her memory. She had 7 hours ahead of her. 7 hours of compliance. 7 hours of following rules that defied explanation. She checked the red light above room 412. It was on. She poured herself coffee, opened the binder, and waited for 3:45 a.m. The protocol continued. It always did.